we should all of us know that the diabetic eye disease actually represents the #1 leading cause of vision loss all over the world in the working age adults. And this gives us an idea about how much this problem is very big and huge. Globally, we can imagine that about 400 million people with diabetes in the world expected to increase to about maybe 600 million people in 2035. More than 90 million of these people with diabetic retinopathy. And almost affect 1 out of 3 persons with diabetes mellitus. You can imagine that about more than 50 million of the people, they have proliferative diabetic retinopathy. More than 20 million of them, they will develop diabetic macular edema. And you can imagine that about 30 million people, they suffer from or will suffer from a vision-threatening condition. Actually, it's no significant difference between different ethnics in worldwide. That's why this disease affects most of the ethnics all over the world. You can imagine that 3 out of 4 patients in diabetes type 1 and 1 out of 4 will have diabetic retinopathy. And we can all expect that all these changes and the increase in the prevalence usually or most probably due to the changes in our diet and lifestyle these days, depending on the junk foods and these issues. We'll go briefly, very briefly, through the pathophysiology. I know Dr. Rashid will talk about it in more details, of course. This diagram shows briefly how much or how the pathway of pathophysiology and diabetes. It's briefly summarized in the hyperglycemia, which lead to disorder of the sorbitol metabolism inside the cells, and this will destruct or distort the basement membrane, and the destruction of the pericytes of the microvessels, and this will lead to leakage and formation of occlusions, microaneurysm, definitely will lead to ischemia, and this ischemia eventually will initiate the secretion of vascular endothelial growth factors, and this will initiate new vessels everywhere in the eye, development of the neovascular glaucoma, and vitreous hemorrhage, and retina detachment, and eventually, unfortunately, at the end will lead to loss of vision. We should know all of us should know the risk factors that may lead to the deterioration of the diabetic retinopathy to avoid as much as we can and do much screening of the people who are in high risk. In type 1, about 25% of the patients will suffer from diabetes retinopathy after 5 years and increase to 80% after 15 years. Half of the patient under 30 years, you can imagine, will develop BDR if the duration of diabetes mellitus more than 20 years. In type 2, the percentage is less. More than 50% of the patients will have diabetic retinopathy after 19 years. BDR will develop in 2% of the patient if duration less than 5 years, and more than or about 20% in all types will develop diabetic retinopathy after 15 years. Other risk factors like glycemic control, high blood pressure, renal disease, lipid profile, uncontrolled clotting factors, or physical inactivity. Pregnancy also may lead to worsening of the diabetic retinopathy, but gestational diabetes doesn't have any problem with the diabetes. Many trials have been done to show us how much the importance of controlling and screening of the diabetic patients to prevent any further deterioration. One of those are the diabetic control and complication trials, which shows us that the intensive and tight control of diabetes and blood sugar level will have a very good and effective background on the development of diabetic retinopathy. It shows that with the intensive and tight control of blood sugar, with the hemoglobin A1C around 7.2%, this will lead to definitely decrease the risk of progression of diabetic retinopathy by more than 50%, and decrease the development of severe NPDR and BDR by about 50%, and decrease the need of laser by about more than 50%, and even the development of diabetic macular edema will decrease by about 23%. Other study like UK prospective diabetic study, this study added the importance of tight controlling of blood pressure over the tight control of the blood sugar. And this study showed us that the tight control of both of them, of these factors, will definitely lead to decrease the risk of microvascular changes by about 37%, and the need for laser by almost 35%. And even the risk of drop of vision will drop by about 50% if the patient controlled his blood pressure and blood sugar. Another study like the early treatment diabetic retinopathy study, which proved that the PRP can reduce the risk of severe vision loss to less than 2% if administered in the appropriate timing and stage. And this illustrates and clarify the importance of early and timely and properly referral of the patients who are in need for good follow-up and screening. The diabetic retinopathy vitrectomy study, after 2 years of following up patients after early vitrectomy and late vitrectomy, they found that about 40% of the patients with early vitrectomy, comparing with 12% of the patients with late vitrectomy in case of severe PDR, both of them gained vision of 20/40 or better. Screening should be done through imaging, and you have a lot of techniques and methods to do screening for the patients with diabetes mellitus and definitely diabetic retinopathy. The most commonly used one is the ophthalmoscopy, but we have stereoscopic color fundus photography, fluorescein, digital color photography, whether it's mydriatic or non-mydriatic. The most commonly used is the ophthalmoscopy, but we have to know that if it's done with a non-trained person, the sensitivity will decrease clearly, and that's why we recommend to be done by clear or well-trained skilled persons. The gold standard one for screening and follow-up of the patients with diabetes mellitus and the diabetic retinopathy is, of course, the stereoscopic color fundus photography, 7 standard field, but it needs actually very skilled photographer and also well-trained readers, and it takes or consume a lot of time and effort. That's why the patient do not recommend it, and it's not actually ideal screening technique. Thanks for the advancement in technology and inventing us or giving us the single field fundus photography, which proved as the level 1 evidence that single field fundus photography with interpretation by trained leaders actually give us a very good idea about if any changes in the fundus in diabetic patients or not. It's very easy and very convenient for the doctor and the optometrist, and very appreciated by the patients because it doesn't take any time and even can be done without mydriasis. But actually it's not sensitive like the 7-field fundus photography. And this pushes us to the role of the primary care providers and even the general practitioner or the optometrist in the screening and monitoring of the patient of diabetes mellitus and discovering the cases of diabetic retinopathy. It's very important to optimize the glycemic control and managing the other risk factors, and you encourage the patient to be referred and to the ophthalmologist. It's very important for the primary care provider to educate the patients, not only the patients, but also his friends and his family about the importance of keeping follow-up with the ophthalmologist. And this point will push us also to the importance of using the artificial intelligence, especially in the hospitals with very high flow and the areas with very low medical staff. And that's why big companies like Google and IBM, they used to try to use their sophisticated programs and the face identification in identifying the signs of diabetic retinopathy in patients with diabetes mellitus. They created a network from about 54 US licensed ophthalmologists, and they used about more than 120,000 of retinal images, and they fed it inside the complicated or sophisticated programs to create what's called deep learning algorithm This algorithm has the capability to identify signs of diabetic retinopathy in patients with diabetes mellitus. And this program shows very high performance and very high sensitivity and specificity in most of the cases if they have moderate or worse diabetic retinopathy. It's very important. It will form a very important breakthrough in the future. So if you go shortly through the recommendations, patients with diabetes have to go regularly and be examined and advised by the primary care provider to be seen regularly depending on their stage. The care process for diabetic retinopathy includes very good medical history, ophthalmic examination. We need referral to the ophthalmologist by the medical care provider. Type 1, for example, diabetes has to be advised that it has to stop for examination once discovered, but type 1 has to be stopped by the ophthalmologist after 5 years. Pregnancy is very important for all the women that they have to know that gestational diabetes do not require any eye examination, while the regular diabetes that has to be seen depending on the stage after 1 to 3 months of the severe or maybe immediately after the pregnancy. If you like to send a message to our diabetic patients, it's very important to advise him. He has to protect his vision from diabetes, have a diabetic eye exam every year or as advised by his ophthalmologist, to maintain healthy weight and add more physical activity. Please control your hemoglobin A1C, blood sugar, and the cholesterol. If you are smoking, please try to quit smoking. And finally, or the gold standard message from this short presentation is the early detection and timely treatment sure can prevent blindness. Thanks a lot, and wishing you the best. Thank you.